big part of what we're working on is psychoeducation. I think very, very few patients and families understand what's actually happening with THC in the adolescent brain and the critical nature about cessation and abstinence around that. Second thing is about promoting abstinence in a supportive community. It is very hard to be abstinent on your own. Isolation is very difficult for most mental health disorders and is absolutely very difficult for individuals trying to be abstinent. So a lot of it is getting somebody into a supportive recovery community, helping kids put up boundaries with friends who are using, and finding sober compatriots that they can spend time with and enjoy spending time with. Certainly for kids that have alcohol, opioid, and nicotine use disorders, we have meds for them, but unfortunately for cannabis use disorders, we really don't. The one exception to that is N-acetylcysteine, or NAC. That has had some preliminary research, some good research done by titans in the adolescent addiction space show small effect sizes for helping with THC cessation. So that is something that you'll see kind of adolescent addictionologists use. It's for good reason. The risks are profoundly low. The benefit's not huge, but even if you can eke a small benefit for basically no risk, the risk to reward benefit ratio is pretty good. But this is certainly an ongoing area of active research. A big part of treatment is helping individuals develop an identity of their sober self. For many individuals, cannabis use is not, just an addictive thing or just self-medication. It actually becomes like their personality. They identify, with the stoner lifestyle, stoner culture. They identify, with the other people who use, and it's a big part of their core self. And so that's a real interesting task to work on changing that. Certainly, fostering those connections to healthy peers, peer recovery networks, family members, that can be supportive. And then, of course, competent treatment providers makes a big difference. And then, as I was mentioning, in many of these cases, substance use disorders are emerging out of adolescents who are already really struggling with something, right? And so it's a big mistake to say, like, oh, look, this cannabis use, it's a real significant concern. We need to put 100% of our energy at that, right? It is a real significant concern, more than 99.9% of the population know, but you really need to also go after what was bringing on that cannabis use in the first place, right? We certainly work to target symptoms of anxiety and depression in treatment, whether that's through pharmacology, whether it's through targeted psychotherapy skills, affectionately referred to as coping skills, which is, I guess, the most popular two words to put together when you're talking about adolescent treatment. And from my end, I think a big part of it too is kind of the holistic improvements, which are, the things that actually have science and research behind them. Getting good sleep, working on ways to make that happen, eating, consistent and balanced meals throughout the day, engaging in joyful movement that helps your brain out. And then, of course, having healthy relationships to social media and with other kids. If you just touched on those 5 things for the average adolescent, the whole mental health space would just look completely different than it does right now. And I'm glad that, even though the word holistic makes me gag a little bit, that people are really working on identifying and targeting those topics more these days. And certainly addressing underlying trauma, whether or not it's coming from bullying, from issues that kids have been through things that have happened at home, things that have happened in their communities. Obviously we're living through what's going on in the Middle East right now. So really making sure that we're targeting these kind of things in treatment. Certainly working on the family system can be a huge source of support for our adolescents who are struggling with substance use disorders. And as I mentioned in the past, kind of addressing the impact of intergenerational and family traumas and how that's affecting the patient who's in front of us. And then actually I think kind of one of the most important parts is getting set up for the future, right? And what I hear from adolescents who've struggled with really severe substance use disorders is, okay, I'm sober, I'm even sober living at home, I'm not going out and acquiring substances, but I still feel like crap, right? And a big part of treatment is not just getting sober and staying sober, although that is a big part of treatment. It's setting up life to, thrive and to have something that you're looking forward to. As one of my patients said, is like making a life worth being sober for.